Hello everybody, welcome back and welcome to our first video of the new year. And as you can see, still got a few Christmas lights behind me, and we've enjoyed Christmas here. Hope you all have. And we're getting into the new year and we're getting people ringing up and they're saying, I think this is wrong with me. I think I've got sciatica. I think I've got arthritis. I think I've got sinus problems. I think I've got polycystic ovaries. Can chiropractic care help me? And what I try to share with people, not too quickly because it's a different way of looking at things, is we say to people, well, really when we work with a person, we're going to listen to what you feel's wrong with you, and we're going to listen to what you believe is wrong with you. But how about if we have a look at what's right with you as well? And a lot of people haven't heard of that before when they first come to us. A lot of people say, what do you mean you're going to have a look at what's right with me? So whenever we look at a person, and they usually come into us and they'll usually have a list of things that's wrong with them. So just today we had a lady with sinus problems. Then we had a lady who came into us expecting that we can help her, which was good. And she's had neck problems, back problems, a knee problem, and wrist problems. And what we say to people is, we've all sort of grown up knowing that if we go and see, say, a specialist, they're going to look at the wrist, they're going to look at each wrist, they're going to look at the neck, they're going to look at the back. But we like to look in a different way, and we like to look at the core of a person. And there's different ways of looking at this, and other people are going to have some different ideas. But we view your core as being your brain, and then your spinal cord or your brain cord, because at the bottom of your brain, so if you think of your brain as being like a tadpole, the brain's the head, and then the tail is the brain cord. Well, that brain cord goes all the way through your spine, and then it connects up to all the rest of your body. So we say to people, well, let's look at your core. Let's look at how well your brain is able to talk through your brain cord that lives inside the spine. So if I was showing you just quickly what that looks like. So we've got here, the diagram's called brain and nerves, as you can see. I love this diagram, it's so helpful. But really what we're talking about is your core. The core of a person in a lot of ways is the brain. So you've got a lump of fat and water here, and that lump of fat and water provides all the energy and information that keeps your body alive, keeps it supported, helps it to heal, helps it to get better. And then this thing here is your brain cord, and it runs all the way through, and then it's kind of like a motorway with lots of exits coming off. And when you look at the exits, all the exits come off and go to things like, some of the exits go to your lungs, some go to your stomach and your liver and your kidneys, some go to your reproductive system, and then sciatic nerves, for instance, go all the way down there and into the legs. So we call the brain the spinal cord, and the spine that wraps around it. So let me show you that. So if we pop this on the desk, lots of models today. We call this, if you look at the colours, it's almost like a psychedelic spine. So somebody once said, is it from Woodstock? But anyway, when you look at it close up, there's the brain cord. This yellow thing you can see, that's the brain cord. If we look up here in the neck, that yellow thing you can see, that's the brain cord. So your core, in other words, your brain and your spinal cord, your core, are protected by your spine, and your spine is like a suit of armour to protect it. So hopefully I'm making a bit of sense. It's been a busy day. So it might sound odd at first, no matter what somebody comes into us with. So we've worked with cancer patients is one example. We've worked with people with multiple sclerosis. And as a rule, without sounding arrogant, we don't mind what somebody's symptoms are. We don't mind what somebody's diagnosis is, because rather than saying, well, let's look at your diagnosis, let's try and treat what's wrong with you, we look at your spine, and what we're looking at then when we look at a person's core is this. So when we're looking at the core, really when a person comes into me, I'm going to go up to them and go, right, okay, how's this part of your core moving? How's this part? How's that part? Especially we're going to look at how is your core moving up in your neck. So if you imagine right where you can see that kind of silver piston looking thing at the top, that's where your brain would be. Right, so when we look at you all the way down and go through, what we do with a person when they come in is the first thing we do is use our hands to check and see how each part of the core is moving or working. And then when I said, well, we're going to look at what's right with you as well as what's wrong with you, when we find a place in somebody's core that's stuck and misaligned and affecting that person's brain and body from working together, people say, well, Mike, that's a really, really bad thing, isn't it? And I'll say, well, my choice of words would be, it's extremely significant, because if your core is stuck and your brain can't talk to your body fully, well, it speaks for itself. But on the other hand, I get excited because if we check somebody's core or the spine, same thing, and we say, well, here is stuck and misaligned, here is stuck and misaligned, round in your mid-back or your low back. Mrs. Jones, if we worked on freeing up that part of your core and we helped your brain and your body be able to work together, would you like that? And practically everybody goes, yeah, I'd like that. And we say to people, well, you've got a brain and a body, haven't you? Yeah. If we can help them communicate, do you think that'd be a good thing for you? And people have often not heard of that before, but almost everybody goes, yep. So then when we start working with a person, what we're looking to do is, it's really simple. If you free up a person's core, then their core and the body around it all can work together better. So in that sense, when we're working with people, we're working to help them free up and reconnect with themselves on the inside. We're not really at all trying to treat a disease or an injury. And I hope that makes sense, because lots of people, when they come to us, they've heard, well, chiropractors can fix back problems, fix neck problems, fix sciatica, fix bad discs. But the reality is it sounds odd, and it's took me a long time to appreciate, we're not fixing anything. We're helping a person reconnect the brain and the body by freeing up the core or freeing up the spine, the brain cord, and the connection to the body around it. And when you do that for a person, it puts them back in the driving seat, without them even trying, of being able to heal better. Because all around your body all of the time, your body's doing millions of things to keep you alive. I think that's a miracle in its own right. Your body's doing millions of things just to keep you alive without you even trying. And a big one is your body's constantly replacing and reconnecting itself. So if we help your brain and body be better connected, it's going to be easier for it to reconnect and replace itself in a better way. So the way I used to have it explained to me would be, somebody could have, I don't know, let's say a stomach problem. You could give them every tablet known to man for the stomach, but what about making sure the connection between a person's brain and stomach is better? Now, I'm back now to talking about working with somebody with a specific thing. But again, when we work on a person, it's not like we look at a person and go, right, Dave over here has got a bad back, so we're just going to work on his back. Or Sue has got headaches, sinus troubles, and is struggling with anxiety. We say, well, we've heard what a person's symptoms are. That's important because it's important to them. Let's have a look at the whole core and free it up. And there can often be areas that we free up that a person isn't aware is part of the problem, doesn't hurt them. So the big one is, a lot of people come in and they'll say, Mike, why are you working with my neck? Because I've not got any neck pain. I'll say, well, the reason we're working with your neck is we're freeing up your core, or we're freeing up your brain cord, and that's going to help your brain connect up better to the rest of your body. And if we only worked on your low back, and we didn't work on the connection between the brain and your body and your low back, we'd be really, really selling you short. So the point I was trying to make in this whole video is, when you have chiropractic care, it all revolves around free up a person's nervous system, help the brain and body connect up better, and people have got that much ridiculous potential to heal and get better that I do that. It takes me 1 or 2 minutes, and then I just get out of the way, because the person's body and their mind does all the healing and gives them and provides them all the results that they get when they have chiropractic care. So I even tell people I can't really claim any credit when you get better, and people still thank me as if I've done it, and you know, you accept that thanks because it's a nice compliment. But the reality is, when you go to a chiropractor who knows these things about chiropractic, they don't get talked about much. If you go on Google, it's all going to be about back pain and sciatica. But in the olden days, that the whole mission of chiropractors was, when a person walks through your door, don't worry about what's wrong with them, have a look at the spine, work with what's right with them, free up the brain, free up the spinal cord, let the person do their own getting better. And that's why in the olden days, and this is documented, people went to chiropractors with horrific problems, crippled, blind, deaf, maimed, babies that were failing to thrive, babies that were not even moving, and they had chiropractic care, and practically everybody in that era benefited. And we see similar things with patients here. And in this day and age, it's not really considered politically correct to talk about chiropractic outside of back pain and neck pain, but I'm going to tell it like it is, because we had a baby once come to us, and within 24 hours of her first adjustment, she was about 18 months old. She's pinned to the top of our Facebook page, we like her that much. And within 24 hours, she'd gone from not moving to starting crawling. And that's not because I fixed her or put a medication into her or did some surgery. It's because we just, again, looked at her core, freed up her core, helped her little brain and body to work together. She did everything else. So I just wanted to make sure that people out there thinking about chiropractic, interested in it, know that there's so much depth in people to get better. It's ridiculous. And all I do really is get to show up and be almost like a mechanic, but with living people rather than Ford Focuses or Fiestas or whatever else. So I've talked a lot. My wife would tell you I usually do. Hope you've enjoyed the video, everybody, and let's just thank everybody who's on here. Ian, good to see you. Wendy, good to see you. Carl, good evening to you. Thanks for being here. Jane, hiya Jane, I hope you're well, and I hope Wayne is too. Jill, thank you for being on here. All the way from Dubai, Sharik, good evening to you. Nice to see you. Arunus, good evening. Good to see you. One of the strongest people I've ever seen. Emma, what can I say? A legend in her own right. Good evening to you. Ellen, thank you for being on here. Julie, thanks for being on here, and thanks for recommending people come and take a look at chiropractic. Sharon, I hope you and the girls and your mum and your dad are well. Colin, aka Father Christmas, good evening to you. Thanks for being on here. Lillian, we are well, thank you, and I hope you are too. Thank you. And Emma, more messages. Thank you, Emma. Thank you. And we've got John. Good evening to you, John. Thanks for being on here. Cheryl, I hope you and your family are well. Good to see you. Jan, good to see you. And Dawn, good to see you. Hello to you and Stephen. Have a good evening, everybody. Thanks for watching. Bye-bye, everyone.